Let's talk about the shoulder. It's this incredible whirlwind of muscles, bones, and ligaments all working together. But hidden deep inside all that complexity are these tiny, super important pathways. They're basically secret gateways for the nerves and vessels that make your arm work. So today, we're going to take a guided tour of these passages. Right. Think of the shoulder like a super busy city intersection. You've got these huge buildings, the muscles and bones, everywhere. But how does the traffic, the nerve signals and the blood supply get from point A to point B without getting totally gridlocked? That's the big question, and that's exactly what we're going to map out right now.
Okay, first stop on our tour is a very unique gateway, the quadrilateral space. And the name kind of gives it away, right? It's got 4 sides, and it is our first critical junction.
And there it is. See that little 4-sided window? It's tucked away right there behind the shoulder, formed where a few different muscles and the humerus bone all meet up. So, let's get specific and define its borders.
Every space needs walls, right? Well, for this one, the teres minor muscle acts as the ceiling, or the superior border. Down below, the floor is made by the teres major. The inside wall, the one closer to your spine, is the long head of the triceps. And finally, the outside wall is the bone itself, the surgical neck of the humerus.
So, what's the big deal about this little 4-sided box? Well, it's all about what's passing through it. We're talking about the axillary nerve. This nerve is absolutely crucial for shoulder function, and it has to squeeze right through this tight little corridor, along with some key blood vessels. This makes the quadrangular space a really high-stakes piece of anatomical real estate. You ready to keep going? Because right next door to our 4-sided space, we've got not 1, but 2 important triangular spaces. It's a whole neighborhood of gateways back there. Okay, first up is what's often called the upper triangular space. You can see it on the diagram right here, just kind of nestled in, medial to the quadrangular space we just looked at. And you'll probably notice some familiar names forming its borders. This really shows you just how interconnected this whole area is. So for this triangle, teres minor is once again the top border and teres major is the bottom border. But here's the twist. This time, the long head of the triceps muscle forms the lateral border, basically closing off that side of the triangle. Now, the main traffic passing through this particular triangle isn't a nerve. Nope, it's all about the plumbing. The circumflex scapular vessels pass through here, and they're essential for getting blood to all the muscles around your shoulder blade. It's a critical supply line. Now, let's shift our eyes just a little bit downwards to our third and final space, the triangular interval. Some people call it the lower triangular space, and you can see it sitting just below the teres major muscle. So let's map its borders out. Up top, we've got the teres major. The medial, or inner border, is, you guessed it, the long head of the triceps again. And on the lateral side, the outer wall is just the shaft of the humerus. So you've got muscle, muscle, and bone creating this really important interval. And hey, if you thought the quadrangular space was high stakes, well, this one is the main event. For real. The major passenger cruising through the triangular interval is the radial nerve, a massive, incredibly important nerve for pretty much your entire arm and hand. This isn't just a side street. This is a superhighway. Okay, I know, teres minor, teres major, quadrangular this, triangular that, it's a lot to keep straight. Your head's probably spinning, right? It can feel like you're just memorizing a list of facts. But what if there was a way to make it all just click? And I mean that literally. What if you already have the perfect model for remembering all of this? And it's attached to your arm right now. And this is it. Look at this. It's brilliant. Use your own hand. Just imagine your index finger is the teres minor muscle, your middle finger is the teres major. Now your ring finger represents the long head of the triceps, and your arm itself is the humerus. Now look what just happened. The space is formed perfectly. The gap between your index, middle, ring finger, and your arm, that's the quadrangular space. The gap between just the index, middle, and ring fingers, that's your triangular space. And the space between the middle finger, ring finger, and your arm, boom, that's the triangular interval. It's all right there. So now that you've got this incredible mental map, literally in the palm of your hand, let's just quickly nail down why it's so important to know the layout of these little neurovascular neighborhoods. Let's lock this in. Quick fire round. You hear quadrangular space, you think axillary nerve. You hear triangular interval, you think radial nerve. And the triangular space is the channel for the circumflex scapular vessels. See? Each space has its critical cargo. If you know the space, you know what's at risk. And that brings us to the final, really important thought.
Now that you know the roadmap of these highways, you can start asking the really interesting questions. What happens when these spaces get compressed, maybe from an injury or just overuse? What happens when one of these neurovascular roads gets blocked? Knowing the map is the first crucial step to understanding the traffic jams. Something to think about.